Hello, my name is Dr. Brooke Rawls, and my title is Medical Social Worker. I currently work in a hospital system in the Pittsburgh, Pennsylvania area. The populations I serve include adults 18 years of age and older, including geriatric populations. My main responsibilities in a typical week truly vary. However, they always include completing initial assessments for individuals who have been hospitalized. And this helps us get a full picture of a patient's needs. At the time of assessment, we screen for different types of abuse, including intimate partner violence and elder abuse. We use the information attained from the assessments to determine if the patient will have any needs when it's time for their discharge. The needs of a patient at discharge is truly unique to that specific patient and to their situation. Different post-acute needs may include returning home without any services, returning home with new medical equipment or in-home support, going to a higher level of care such as a nursing home or physical rehabilitation center. It may also include going somewhere for drug and alcohol treatment or mental health treatment. In addition to assessing for discharge needs, I also provide support to patients and their families regarding their medical conditions. This may include information on making medical decisions such as medical interventions and surgeries, and end-of-life care or hospice. I also provide crisis intervention or grief and loss support when a patient and their family member encounter an unexpected medical event that can be considered traumatic or life-changing. Additionally, with older adults, a lot of times this may entail supporting them through the beginning stages of loss of independence. When a patient realizes that they no longer can care for themselves on their own and that they need some level of assistance, it can be difficult for them to process. The skills necessary for succeeding in medical social work include strong time management skills, organizational skills, critical thinking skills, high compassion and understanding with a touch of assertiveness. What I find most enjoyable about my work is the ever changing environment. You never know what your day will hold when you work in the hospital. You get to meet so many different people at different stages in their life. And the support and information that you provide them makes a huge difference in their overall medical experience. I would have to say that what I like least about my work is when I feel there are limited resources available to truly help a patient in need. This sometimes leaves me feeling inadequate in my role. And although over the years I have learned that there's always something that I can do to help, it can be hard to accept that sometimes my best just has to be enough. And some of the biggest challenges I face in this position is the lack of resources in the community, especially for those without medical insurance or for those struggling with various forms of addiction. Something I wish I had known when I first started working in the human service field is that I cannot do everything on my own. Human service professionals really rely on different systems working together to provide complete and holistic services to the individuals we serve. However, when there's a breakdown in these services, we realize that it's our populations that suffer. So that's why the advice I have for human service students about to enter this field is to learn everything there is about the population you serve. Know what other community programs or resources are available in your area and update this knowledge on a regular basis. Resources change all the time, so it is extremely important that we are up to date on everything that is available. This also means that we have to network with other professionals within different professions. Make connections that will enhance your knowledge and the knowledge you can share with others. Thank you.